Imagine waking up one morning and something feels off. You try to stand, but your legs feel heavier than usual. Not painful, just unresponsive. You reach for your phone and your hand tingles like it's half asleep. Then you notice your vision. Slightly blurred, slightly doubled. You tell yourself it's nothing, maybe stress, maybe fatigue. But days pass and it doesn't go away. For millions of people around the world, this is not temporary. This is multiple sclerosis, a disease that doesn't always show on the outside, but slowly changes how your body works from the inside. And for many, the hardest part isn't just the symptoms, it's the unpredictability. In this video, we'll break down what multiple sclerosis really is, what's happening inside the body, the early warning signs, treatment options, and what it actually feels like to live with a condition that most people can't see. What is multiple sclerosis? Multiple sclerosis is often misunderstood. People think it's just a disease that affects walking, but in reality, it's much more complex than that. Multiple sclerosis, or MS, is a chronic autoimmune disease that targets the central nervous system, which includes the brain and spinal cord. In simple terms, the immune system, which is supposed to protect you, starts attacking your own body. Specifically, it attacks something called myelin. Myelin is a protective layer that surrounds your nerve fibers. You can think of it like insulation around electrical wires. It helps messages travel quickly and efficiently between your brain and the rest of your body. But when MS damages that insulation, those signals slow down, become distorted, or stop completely. And when communication breaks down inside your body, everything can be affected. Movement, vision, sensation, even thinking and emotions. That's why MS is often called an invisible illness, because from the outside, someone may look completely fine, while inside their nervous system is struggling to function normally. What happens inside the body? So what's actually happening beneath the surface? When the immune system attacks myelin, it creates inflammation. This inflammation damages the nerve fibers and leaves behind scar tissue, also known as lesions. These lesions can form anywhere in the central nervous system, and where they form determines what symptoms appear. If lesions develop in the optic nerve, vision is affected. If they form in the spinal cord, movement and coordination may suffer. If they appear in certain brain regions, memory, focus, or emotional regulation can change. Over time, repeated attacks can lead to permanent nerve damage. And unlike some other tissues in the body, nerves don't always repair themselves completely. That's why early diagnosis and treatment are so important. But here's what makes MS especially challenging. It doesn't follow a predictable path. There are different types of MS: relapsing remitting MS, RRMS, the most common form, where symptoms flare up and then partially improve. Secondary progressive MS, SPMS, where symptoms gradually worsen over time. Primary progressive MS, PPMS, where symptoms steadily progress from the beginning without clear relapses. Each person's experience is different. Some people may go years with mild symptoms, others may experience rapid progression, and that uncertainty can be one of the most difficult parts of living with MS. Signs and symptoms. So how do you recognize multiple sclerosis? The early signs can be subtle, easy to dismiss, easy to ignore, but they often follow certain patterns. One of the most common symptoms is fatigue, not normal tiredness, but a deep, overwhelming exhaustion that doesn't improve with rest. People often describe it as feeling like their body is shutting down. Another early sign is numbness or tingling. It might start in the fingers, the legs, or even the face. It can come and go, or linger for days or weeks. Vision problems are also very common: blurred vision, double vision, or a condition called optic neuritis, where one eye temporarily loses vision and may be painful. Then there's muscle weakness. Simple tasks like climbing stairs or holding objects can suddenly feel difficult. Balance and coordination issues can make walking feel unstable. Some people feel dizzy, others feel like their body isn't responding the way it should. As the condition progresses, symptoms can expand: muscle stiffness and spasms, difficulty speaking clearly, problems with memory and concentration, chronic pain, sensitivity to heat, where symptoms worsen in warm conditions, bladder or bowel dysfunction, and one of the most overlooked symptoms, cognitive changes, difficulty focusing, slower thinking, memory lapses. These can be just as frustrating, if not more, than physical symptoms. But what makes MS truly unique is this: symptoms don't follow a straight line. They can appear suddenly, disappear, return, or change over time. Treatment, medical approach. Now let's talk about treatment. Is there a cure? Not yet, but there has been significant progress. Today, there are many treatments that can help slow the disease and manage symptoms. The main category is called disease-modifying therapies, or DMTs. These medications work by reducing the activity of the immune system, preventing it from attacking the nervous system as aggressively. They don't cure MS, but they can reduce the number of relapses, slow the progression of disability, limit new damage in the brain and spinal cord. Some common types include injectable medications, like interferon beta, which help regulate immune response, oral medications, which are easier to take and help reduce inflammation, infusion therapies, such as monoclonal antibodies, which target specific immune cells involved in the disease process. Each treatment has its own risks and benefits. That's why choosing the right one is a personalized decision between the patient and their doctor. In addition to DMTs, symptom management is essential. Doctors may prescribe muscle relaxants for stiffness and spasms, medications to reduce fatigue, pain management treatments, antidepressants for mood support. Because MS doesn't just affect the body, it affects the whole person. What causes MS? So why does MS happen? The truth is, we don't have a single clear answer, but research points to a combination of factors. Genetics may increase susceptibility, but MS is not directly inherited. Environmental factors also play a role. Low vitamin D levels, limited sunlight exposure, certain viral infections, all have been linked to increased risk. And at the center of it all is the immune system, a system designed to protect the body that, in MS, begins to misfire. Importantly, MS is not contagious, and it's not caused by something someone did wrong. It's a complex condition that can affect anyone. Living with MS doesn't just exist in medical charts. It exists in everyday life, in unpredictable energy levels, in moments of frustration and resilience. Some days feel normal, other days feel overwhelming. And because many symptoms are invisible, people often don't understand. They may say, "But you look fine," without realizing how much effort it takes just to get through the day. That's why awareness matters. And empathy matters even more. For families and caregivers, be patient, listen, understand that symptoms can change daily. Offer support, but respect independence. Because people with MS are not defined by their condition. They are still themselves, still capable, still strong, just navigating a different reality. Multiple sclerosis is complex, unpredictable, invisible, lifelong, but it's not the end of a life. It's the beginning of a different one. With the right treatment, the right support, and the right understanding, people with MS can continue to live meaningful, fulfilling lives. And most importantly, they don't have to face it alone. If you found this video helpful, share it with someone who needs it. Subscribe for more content on health, awareness, and real-life medical insight. Because the more we understand, the better we can support.